How do you prevent type 2 diabetes, and can it be reversed?
Yeah, so type 2 diabetes is something that is near and dear to my heart for sure. And I will start sounding like a broken record as I talk about this, but I actually recently wrote 2 books and I'm going to show them to you. One is called Kick Diabetes Essentials and one is called the Kick Diabetes Cookbook. And these books cover this topic in significant detail. So first of all, yes, type 2 diabetes can be reversed. And in fact, in 2009, we had a consensus statement from the American Diabetes Association actually defining what diabetes remission looks like. And it's basically you have normal blood glucose, normal A1C, no diabetes medications or other interventions for at least a year. And there are all sorts of different definitions of diabetes remission. We started seeing diabetes remission with bariatric surgery. That was interesting. And then there was a group in the UK, Roy Taylor's group, that actually said, well, gee, if you could get diabetes remission using these bariatric surgery and you're just eliminating, or reducing food so dramatically, I wonder if we could get it just on a really low calorie diet. So they started doing a whole bunch of studies using, these formulas with, feeding people like 800 calories a day and all sorts of different things. And in fact, they had tremendous success with diabetes remission in these individuals. And they found that for those that lost at least 15 kilos or, 35 or so pounds, they had an over, I think it was over 80% reversal or remission rate. And the less you lost, the lower your remission. And the other thing that affected remission was how long people have had diabetes. So if you've had diabetes, if you're fairly recently diagnosed, your chances of reversing it or going into remission are much higher than someone who has had diabetes and done a lot more damage to their pancreas. But what's really interesting is that when you have fat in your pancreas, and this is called lipotoxicity. So when you store fat in your liver, it actually drives insulin resistance. And your liver can actually put out fat that goes to your muscle tissue and other vital organs like your pancreas. And the pancreas has absolutely no tolerance for storing fat. So when you store fat in your pancreas, it actually puts beta cells to sleep. And by going on a diet and using up these fat stores, that especially in your liver and pancreas, it reverses insulin resistance and it can actually wake up beta cells, which is just amazing. So this is something of great interest to me. But how do you prevent diabetes? Well, number one, you maintain, a healthy body weight. You exercise every day. And so this is something that is a challenge for a lot of people, especially in North America, where 70% of the population is either overweight or obese. So how do you do this? Well, you want to be eating a nutrient dense, which means a lot of nutrients per calorie, high fiber, whole food, plant-based diet featuring a lot of leafy greens, colorful veggies, legumes, intact whole grains, fruits, nuts, seeds. Those should be the foundation of the diet. You want to absolutely minimize processed foods, especially highly processed foods that have added sugar and fat and salt and all of those things. You want to minimize animal products and you want to completely avoid processed meat and red meat because they've been associated with increased risk. You want to get your macronutrients from high fiber whole plant foods. So carbohydrates from whole plant foods, not from refined sources. You want to get your protein from plants rather than animal products. You want to get your fat from whole plant foods rather than concentrated fats and oils or meat. You want to minimize added fats because they contain a lot of calories in a small space. So 1 tablespoon of oil, for example, has 120 calories. And it's just this tiny little thing. You add it to your pasta or your salad. You don't even feel like you're eating anymore, but you're getting a whole lot more calories. And there's almost no nutrients in oil. So you're wanting to get those fats from the whole foods as opposed to the added fats. You want to minimize products of oxidation from cooking. So you want to use more moist cooking methods as opposed to dry cooking methods. You want to avoid blackening foods. You want to avoid frying of foods because you get a lot of products of oxidation when you do that. You want to minimize environmental contaminants, which means eating lower on the food chain, eating organic foods when you can. You want to ensure a source of omega-3 fatty acids, so flax seeds, chia seeds, hemp seeds, walnuts, and possibly using some EPA DHA, because people who have insulin resistance don't tend to convert the plant fats to the long chain fats quite as efficiently. You want to avoid artificial sweeteners. And a lot of people say, artificial sweeteners are so appreciated by people who have diabetes or who are combating diabetes because it allows you to have sweet foods without having the calories. But what it does is it messes with your palate and it makes you want more sweets. But the other thing that it does is it can actually compromise your gut microbiota, and it can cause dysbiosis. And this is not something you want, because when you have dysbiosis, it causes inflammation. And so you just want to avoid artificial sweeteners completely. You want to use plenty of antioxidant-rich herbs and spices. You want water to be your beverage of choice, and you want your diet to be nutritionally adequate. You want enough magnesium and chromium, and so that means consuming a wide variety of foods. And possibly, if you're, really limiting calories, you're having 12 or 1,400 calories a day to try to lose weight, you might want to take a high quality multivitamin mineral supplement.
What about eggs? Are they healthy? What about egg whites?
Well, eggs, the research is a little bit all over the place with eggs. Some suggest higher rates of disease and mortality with egg consumption, and others finding, not a huge impact with egg consumption. And I think probably the most important study to me was a study out of Harvard that had over 130,000 participants followed for about 30 years. So this is, a really important study. What they found is they looked at what happened with the individuals in that study if 3% of calories from protein from animal foods was replaced with protein from plants. And to put that into perspective, it's about 60 calories in a 2,000 calorie diet. So 60 calories from eggs would be like one small or medium-sized egg. A large egg has about 80 calories. So what they found was replacing one small or medium egg with about the same amount of calories from plant protein would actually reduce your risk of death by 19%. That is pretty powerful stuff. The figure was about 34% for processed meat and about 12% for unprocessed meat. So eggs were somewhere between processed meat and unprocessed meat. And in addition, eggs are super concentrated in cholesterol. And cholesterol has been associated with a higher risk of liver disease. It's also been, eggs have also been associated with increased risk of prostate cancer. Some studies have shown a very small increased risk of diabetes with egg consumption as well. And now that's with, moderate egg consumption. There was actually a study out of the US that I thought was interesting. They actually reported a 58% higher diabetes risk in men consuming 7 or more eggs a week, and a 77% increased risk in women consuming 7 or more eggs a week. So that's a huge increase. And then there was another Korean research team that reported an almost 3 times increased risk of cardiovascular disease in those eating the most versus the fewest eggs. So we still are seeing studies that would give us cause for concern. And of course, one of the things that I have to say about eggs is these are, you think about chickens. and the egg production. And it is not a pretty picture, I can tell you. Just do a search about how we're producing, the number of eggs we're producing in the United States, for example. All of the eggs that are, all of the chicks that are produced to be egg producers, if they're males, they're just slaughtered, and not in very pretty ways, I might add. And so that's just millions and millions of chicks. Just the numbers are extraordinary. And we keep these animals in, these confined conditions where they can't even, expand their wings, or they can't even move. It's just awful conditions, so that we can consume these products that probably don't help us much, and may in fact hurt us. So I just don't think it makes a lot of sense to include eggs in the diet.